everybody. I'm Rohini, and I'm so grateful and excited to be here. And today I'll be sharing a little bit from my doctoral study, which I completed in 2023. So for today's sharing, I've titled this presentation as Understanding Sport and Physical Activity as a Public Health Issue. And the case study is of Indo-Fijian women in Fiji. Next slide, please. So, in framing the public health problem, the core challenge is that physical activity is globally promoted as a public health good, yet participation remains uneven across many socio-cultural sort of factors like gender, race, culture, and class. And in this, Indo-Fijian women are largely absent from sporting scenes in Fijian public health narratives. This might not be the case in every aspect of life in Fiji, but I'm just focusing on the sporting aspect. So the central question here is, what happens when women's bodies are culturally constrained, racialized, and excluded from sporting spaces meant to promote health? And access to physical activity is a health equity issue, not just a lifestyle choice. That's something I wanted to have as a backdrop as I go on with this presentation. Next slide, please. So for my doctoral study, why Indo-Fijian women, I am of an Indo-Fijian background and migrated to Australia and been here for 16 years. And these are certain things I noticed, and it's a lived experience as well. So this cohort is under-researched and often invisible in the sports scholarship. And they experience intersectional marginalization, which is shaped by gender, ethnicity, their migration history of being indentured laborers, religion, class, and caste. And they also face culturally embedded norms around femininity, respectability, modesty, and domestic roles, which shape their access to sports and movement culture in Fiji. Moreover, in Fiji, sports is shaped by hegemonic masculinity and dominant sports discourse, and many times minority groups of women can find themselves excluded from such spaces. So in the Fijian context, sports is not a neutral space. It is racialized, engendered, and these conditions shape who feels safe, legitimate, and welcome to participate in the movement culture of the country. Next slide, please. So I have used a research methodology which combines visual and arts-based methods with reflexive ethnography to center the experiences of these women. And these methods are, in terms of public health research tools, are seen as cultural ways of knowing. It's honoring the cultural ways of knowing. It helps reduce extractive practices, and it also helps build trust with the participants. And since they're contributing as well as a participatory action sort of research, so they feel quite very much part of the research. Next slide, please. So what were the implications in terms of my research at the individual level? In terms of physical and mental health and confidence, the participants found that engaging in sport or movement culture help improve physical and mental health and help build their self-confidence. And also participants developed a positive connection with their bodies through the sports that they were doing or the physical activity they were part of. And it also helped them to challenge internalized shame that is associated around femininity and physicality. This is especially for those participants who were playing sports that were associated with men, for example, rugby. And also physical activity became an act of embodied resistance and empowerment for this group of women. So in this sense, health promotion must move beyond weight and cosmetic fitness and risk. Although these are important, but we need to move towards agency, dignity, and belonging. Next slide, please. So looking at the community and family level implications, the families were not just barriers, they were sites of negotiation and change for these young women. And through educational achievement, sporting success, and relational negotiation, most of the participants shifted family perceptions from restriction to cautious support, and some were able to even move towards pride. Looking at the community level change and implication, male-dominated sporting spaces in Fiji often silence women and produce surveillance. Yet supportive coaches for these young women and allies in culturally safe spaces enabled continued participation, leadership pathways, and also some intergenerational change. So the key insight here is equity-focused sport policy and practice can reduce gendered and racialized health gaps, and family-engaged approaches support sustainable physical activity across the lifespan. Next slide, please. So in terms of public health recommendations, there's a need to introduce or have culturally inclusive PE and sports programs, which includes and addresses sociocultural factors such as race, gender, religion, class, historical inequalities, and also to integrate culturally meaningful activities that ensure equitable access to diverse sporting pathways. It's also important to expand physical education beyond Western-focused approaches to include traditional sports, dance, and other culturally resonant physical activities and leisure activities. Moreover, there is a need to increase representation of minority groups, that is in school team sports and sport career pathways as well. Another important recommendation is to showcase her story, increase visibility of minority groups of women role models to inspire participation and challenge stereotypes, for example, of Indo-Fijian women being stereotyped as lacking physicality or not having sporting prowess. And also have open pathways to contact and dominant sports for all genders and ethnic groups. So, for example, introducing rugby, regardless of gender and race, into the school system, so everybody has a fair go in case they want to try out rugby. And finally, the recommendation of using participatory and arts-based methods to inform culturally safe preventative health, public health and strategies and policy change. Next slide, please. So this is my vision, a strength-based vision for health equity in Fiji. And this is reframing the narrative. So Indo-Fijian women and other minority groups are not hard to reach. Systems are. My research reframes these women and other minority groups of women as strategists, negotiators, and change makers. Health equity requires culturally grounded programs, recognition of embodied knowledge, and community-led sport and physical activity initiatives. So how does the path going forward look like? So when women are supported to move freely, public health outcomes improve, not just for individuals, but for families and the community. And these are the last thoughts that I want you to leave with. Physical activity becomes most powerful for public health when it is culturally safe, socially just, and grounded in lived experiences. Thank you.